All right. Hello, everybody. I'll just give a couple minutes for everybody to join. And as you guys are joining, if somebody can just drop in the chat, let me know if my sound is okay. Let me know if you can see me all right. That would be awesome. Thank you, Kelly. Thank you, Francine. Hi, guys. Amazing. Thanks, Brent. Brent's here helping me out, making sure everything seems good. Wonderful. Awesome. Okay, let's get started and people will trickle in. So thank you guys for coming tonight to listen to all things that have to do with bloating and gas and diarrhea, one of my favorite topics for sure. So I do want to let you guys know that this is being recorded. So if for some reason there's something you want to go back to later and see it again, you'll be able to get the replay and to access it. This is for educational purposes only. I'm not going to be giving specific treatment advice, but just lots of good information about irritable bowel syndrome. As always, if you need a diagnosis specific to you, please go see your naturopath, your medical doctor, whoever your healthcare professional is. And in the Q&A or the chats, please feel free to put questions in. I love answering questions. That's what I'm here for. But I can't give specific treatment advice to you. So just keep the questions kind of general. And then please stay till the end because I'm going to be giving away a free consult with me. And I'd love for one of you guys to win that. All right, so let's talk about irritable bowel syndrome. Two huge facts. First of all, it's the most common gastrointestinal diagnosis, and it's estimated to affect about 20% of Canadians. That is a lot of people, which is one of the reasons why it is my passion, because I come across it a lot in practice. I've been in practice for about 15 years, so I've seen a lot of IBS, and it definitely affects a lot of people. So these are some of the signs of irritable bowel syndrome. Stinky gas, your partner may be telling you that you're clearing the room. Cramping, constipation, diarrhea, bloating, abdominal pain. But I want to hear from you guys that are on the call today. I want to know what is your most troublesome symptom. So I'm going to activate Zoom Fancy feature, which is their polling. And I'll give you guys a couple of seconds to throw in here your vote. What is your most troublesome symptom that you struggle with? Give you a few more seconds. It's anonymous, so don't be shy. Throw your vote in there. Awesome. Great, everybody voted. Wonderful. Oh, yes, awesome. Okay, so now I'm going to share these results with you guys. So bloating is by far the most common symptom at 42% of you guys. And then we have all the fun ways to pass wind, gas, or flatulence, diarrhea, a little bit of constipation, a little bit of heartburn, and lots of abdominal pain. Amazing. Okay, great. So you can see that you guys definitely have very similar symptoms to what I just showed you a moment ago. Okay, now I want to know from all of you, how often are these symptoms happening to you? So let me pull this. All right, go for it. So there's 4 options. Never, I can eat anything I want, occasionally, often and always or daily. Just wait for a couple more people to vote. Wonderful. Okay, I'm going to show you guys the results here. So wow, 62% of you are having these symptoms every single day. And then the rest of you, it's often once or twice a week. So I would say that's actually pretty common what I see in practice. It's rarely, IBS is rarely something that we get once in a blue moon. For most people, it plagues us every single day or at least a few times per week. So what we're going to get into a little bit right now is what does a normal digestive system actually look like? So if any of you have seen me or seen my work, you know that I love my Bristol stool chart. It is so helpful for helping patients identify what a normal poop looks like. And even better, is somebody out there, not me, I cannot take credit for this cake, but somebody out there actually turned the stool chart into a chocolate cake, which I would love to have for my next birthday. So I want to ask you guys, what do you think a normal stool type looks like? I'm going to pull up my poll again. And let me see if I can do this here. All right. Launch. Okay, so which number on this chart do you think your poop should look like? Not what does it look like, but what should it look like? Good, just a couple more of you. And then of course, the second question, how many times per day should you have a bowel movement? And just wait for one more person to vote. Okay, one of you is holding out on the poop polling. I'm going to share that with you. So you guys are a bunch of smarty pants. You're right. Number 3, 4 is actually the normal stool type, and that's what your bowel movements should look like. In terms of how many times per day you should have a bowel movement, twice a day is actually healthier than once a day. And actually, some people would argue you're supposed to poop with every meal that you eat. So 3 times per day. Anywhere between 1 and 3 is fine. I'm pretty happy with that. When people come in and they're having 8 bowel movements a day or none for 2 weeks, I'm really happy to get them somewhere between 1 and 3 bowel movements per day. So that's awesome. All right, here we go. So stool type 3 or 4. The stool shape should be well formed. When you have a bowel movement, everything should hold together. You shouldn't have a massive explosion inside of your toilet bowl. Everything should look like a nice sausage. What should it feel like? It should feel easy to pass. No reading 20-minute magazines on the toilets. That is not normal. It should be pretty easy. You sit down and your poop flows out of you. What about undigested food? I get this question all the time. The only undigested food, let me see if you guys put it in the chat. Does anybody know which undigested food is okay to see in your poop? You can drop it in the chat. Kelly, awesome. Corn, yes, very good. That's right. None except corn and seeds. Yes, thank you, Brent. So that is nature's way of fertilizing the earth, right? We have our poop, it's got the seed dropped inside of it. That's where the plant is going to grow from. That's all normal. It's not normal to see kale and tomatoes in your stool. So those are the things I want you guys to be looking for and making sure that that's not happening. Gas, my favorite topic that nobody talks about. How much is too much? So when we're talking about burps, everybody's going to burp a little bit. 3 to 5 times per day is pretty normal. Your burping should be pretty minimal unless you've eaten something super quickly or you've gulped down something bubbly like a carbonated drink. Of course, you're going to have a big burp. But 3 to 5 times per day max. You should not be thinking about how often you're burping. What about farts? 5 to 15 times per day is actually normal. Yes, so don't aim for 0 farts per day. We are not going to get you there. The goal is somewhere between 5 and 15. And again, it really shouldn't occupy your mind. You shouldn't be wondering, how am I going to escape this room to fart in peace? Everybody has over 1 liter of gas in them. So when you wake up in the morning, that's when typically you're going to let go of most of that gas. So it's normal to have more gas in the morning. 5 to 15. All right. Poop. What is a normal color of poop? So some people will see a little bit of green in their stool, and that's actually quite normal. It's usually related to how much green foods you've been eating. So if you did have a whole bag of kale chips last night, don't be surprised if today you've got a bit of a green tinge to your poop. That is totally normal. If it's super green, then it means you ate 2 bags of kale chips last night. Probably not the best decision. Or the stool is passing through you way too quickly. So there could actually be a malabsorption problem going on. If you have black poop, it could be because you took a medication like iron or bismuth, or it could mean blood in the upper GI tract. So I never want patients to ignore seeing black in their stool, especially if they don't remember taking any iron or bismuth. Make sure you pay attention to that and bring it up to your doctor. What if your stool is pale colored, kind of looking a bit like clay? That actually means that the bile hasn't made its way into the stool mixture, and the bile is what gives it that brown color. So if you have really light stools, it could actually mean that your bile duct is blocked. So if you suddenly see your stools change color, you're going to want to get that checked out right away. Red. Red causes so much alarm for people. If you've eaten beets, you're going to have red poops. Don't need to worry about that. But of course, it could mean that you do have bleeding, fresh blood lower down in the rectum from maybe a fissure, from hemorrhoids. Definitely something you want to get checked out. And then yellow means there's way too much fat in your stool, or you're not absorbing things and it's going through you too quickly. It could also be a sign of celiac disease. And of course, what we're really looking for is that good old any shade of brown. That is really the healthiest color to have. Okay, so I'm curious, how many of you know your transit time? That's how long it should take for food to move from your mouth through your intestinal tract all the way to your anus. How long do you think? I'm going to launch a poll here, and let me see if I can pull it up. Transit time. Okay, you get a chance to vote. So what do you think is normal? Less than 6 hours, 6 to 12 hours, 18 to 24, 24 to 36, or 2 to 3 days? It's a tricky one. Some of you don't know. You're withholding your vote. Okay, awesome. I'm going to share this with you guys. So most of you voted 6 to 12 hours. That is wrong. It's actually 18 to 24 hours is the normal transit time. So it should take you about a day for food that you eat to make its way through you. Let's stop that. 18 to 24 hours. So this is a really fun little test that I do with a lot of my patients, and I do it in the groups that I run. I run a group called the Gut Reset, which is a 6-week group to really get to know your digestive system and how to fix it. And this is one of the first tests that we do. So what you can do tomorrow morning when you get up is eat one of these things. So corn on the cob, sesame seeds, or carrots, and all of them will show up in your stool. Don't chew the carrot too much. Just leave it kind of whole. Just swallow it with some water. About 2 tablespoons of any of those things. And then you note what time you ate them. And then you note when you see it in the toilet bowl. and it should fall somewhere between 18 to 24 hours. If it's a lot longer, obviously you're very constipated usually. And then if it's a lot faster, that's not good either, because food is moving through you too fast and you don't get a chance to absorb all of those nutrients. So you can try this out this week. So I'm going to share with you guys a little bit about why I specialize in irritable bowel syndrome. It might seem like a bit of an odd choice for a lot of people. I will warn you, there's a lot of too much information in this story. But for as long as I can remember, since probably my teens, I remember having trouble with my digestive system. I just always had an irritable bowel, and I carried a change of clothes and baby wipes everywhere I went. Anyone who has IBS will know why I had a change of clothes and wipes in my purse everywhere I went. I would often make excuses not to eat at restaurants or at friends' houses. And at the end of the day, I would wake up in the morning and I would wonder if today would be a good or a bad day. And so you might be asking why I felt all those things. And it was because out of nowhere, I would get spontaneous diarrhea. I would have terrible crippling belly cramps. I remember one time being at a mall and they just came on and I literally could not walk myself to the bus. I had to call a friend to come into the mall and help carry me out. It was so ridiculous. I had foul smelling and embarrassing farts. I could definitely clear the room. I had a lot of headaches, which not everybody with IBS gets, but I definitely had my fair share of them. I had heartburn, not so much GERD or reflux, but a lot of heartburn. Tons of fatigue, felt like an old person, asthma, and anxiety. And last but not least, anal fissures. Yeah, super fun. So these were all the symptoms that I was struggling with from my early teens into my 20s. And I was basically told that I have IBS or irritable bowel syndrome. And I was told to eat more fiber and to learn to relax. So I did what I was told. I ate more fiber and I got even more diarrhea and cramps. I also learned to relax. I did take up meditation and I still believe in it and I think it's amazing, but it didn't take away my diarrhea, my farts, or my cramps at the end of the day. So that's when I realized that IBS is a load of BS. That was the conclusion I came to, because irritable bowel syndrome means that your bowel is irritated. It tells us nothing about how to actually fix the problem. So I was frustrated. I was frustrated with my body. I was definitely frustrated with the healthcare system. So I became a naturopathic doctor. What else are you going to do when you can't figure out what's going on? The good news is that all of you guys don't have to become NDs to figure this out. I will help you sort through your irritable bowel syndrome issues. But most importantly, going through that, it got me to start asking the real question, which was, why is my intestine so irritable? And that's really the question that I want you guys to ask. Is what is your why? I'm just going to check the chat. What did you do before you became an ND? I suffered. I suffered. I tried lots of different things. I remember going to a health food store and buying peppermint capsules to try and solve the problem. I was really treating it on the surface because I didn't understand what was causing it. So I found out my why. I figured out my IBS mystery, and I've spent really over the last decade helping patients do the same. And it's one of the reasons why I love this part of my practice and why I love working with patients, and especially with women with IBS. So my mission today is to help you guys understand what's truly causing your IBS and how to properly get tested and treated. So let's get into the juicy stuff. So the top 3 irritable bowel syndrome myths. Let's just start by debunking some things that are very common misconceptions about IBS. Myth number 1 is that it's all in your head, a psychological disorder. It is not all in your head. I was so frustrated from the number of people that told me, oh, it's just you're thinking about things too much, you're too stressed. Stress definitely plays a role in it, absolutely. Like before you go write an exam, you might have an urge to have a bowel movement. Those two things are connected, your mind and your gut, absolutely. But having daily IBS, we cannot just say it's in your head and due to stress alone. So that myth is false. And the truth is that while anxiety and depression can increase the symptoms, they are not the root cause by any means. Myth number 2. You need to eat more fiber. For most people with IBS, when you eat more fiber, you just feel a whole lot worse. And that is just the way it is. And I will explain why that's the case in a few minutes. Myth number 3 has to do with women in particular. It's your hormones. That is not true either. Again, changes in hormones, they can certainly affect our digestive system. For example, when you have your period, there's lots of contractions going on at the level of the uterus, and the uterus and the rectum are very close together. So if this is contracting, for sure, you're going to get some movement of the rectum and you'll have loose stools. Absolutely. That does not explain what's happening all the other days of the month. And it's true, some hormones can cause bloating and things like that, but it's not going to cause the full spectrum of IBS. So we need to look deeper than just blaming it on our hormones. So what is the most common cause of IBS if it's not all of those things? The most common cause of IBS is something called Sibo, which stands for small intestinal bacterial overgrowth. So Sibo has actually been found to cause 30 to 50% of IBS. In some studies, it's even as much as 80%. And we're just starting to try and figure out what all these numbers actually are. But it accounts for a huge percentage of people who are struggling with IBS. For the longest time, we really didn't have any reason why people had IBS. We would say, oh, it's your hormones, or it's stress, or you're not eating enough fiber. This has been a game changer in the last, I would say, 10 years since Sibo was discovered. We now have an answer as to why so many people are struggling with IBS. So you might be wondering, Jen, what the heck is Sibo and why should I care? Well, I am super happy that you asked, because this is one of the things I love talking about. I actually created this little story for kids that would come into my office, and I would try and explain to them what it was that they had going on inside of them. And so I created a simple story. And at the end of the day, it has actually proven to be the most helpful thing for explaining to adults what they have going on inside of their tummies. So I'm going to go through this with you guys. If you look at this picture here, this is really a beautiful picture of what is going on inside in terms of our anatomy. But luckily for you, that is not the only thing that I have to illustrate what's going on inside of you. Introducing my beautiful digestive system apron. Literally one of my favorite things that I own. How many of you guys have a digestive system apron? Anybody else out there? Like Kelly's gonna say, yes, I do. I'm gonna turn my camera down a tiny bit so you can see me a little bit better. Okay, perfect. So when you look at all this, it looks kind of complicated, right? There's a ton of organs, a bunch of stuff going on. But at the end of the day, what you really have to understand is that you are one gigantic tube. From your mouth, let's pretend this is attached to my mouth, all the way down to your anus. You're literally one ginormous party balloon. I want to introduce you to Bob. So Bob is a gender neutral organism. Bob lives everywhere. Bob really gets around. Bob lives on your food, on your toothbrush, literally everywhere. And we're going to follow Bob through the digestive system, through the ginormous adventure that Bob is going to take. First stop for Bob, imagine Bob going down here. The first stop is going to be the stomach right here. And the best part about this is that you can actually like take off your organ and just hold on to the little stomach. So that first stop in the stomach is so important because it should be full of hydrochloric acid. Hydrochloric acid will kill and destroy Bob, which is a good thing. We don't want Bob hanging out inside of us. So I'm going to ask you guys, see if I can get this poll going here. I'm going to ask you guys 2 questions. Have you ever tested your stomach acid? And if you have tested it, how healthy was it? Remember, it's anonymous. Don't be shy. Give you a few more seconds while I look at the... Okay, thank you, Stephanie. You can't answer either question. And maybe a tech issue. Thank you, Kelly. You do not have an apron. You can borrow mine anytime. You can't hit submit. Oh, weird. Okay. Oh, Zoom. Not always perfect. You can put it in the chat if you want, Stephanie. I have to answer the second question. Yeah, you have to answer both before you can hit submit. Exactly. Never thought about it. Awesome. Okay, good. All right, a few more people voting. This is a tricky one, I know. All right, I'm going to share those with you guys. So have you ever tested your stomach acid? Most of you said no, but actually a good number of you guys said yes. And some of you have never thought about it. And if yes, how healthy was your stomach acid? Most of you were normal, which is fantastic. And then a few of you guys had low. And oh, interesting, someone had high, which is pretty unusual. That's so cool. I was just looking at the chat. Okay, perfect. Yeah, so your stomach acid is super important, right, in killing those bacteria as they enter our body. And this is another thing that we talk a lot about when I either in practice with my patients or when I'm doing the groups is we actually test your stomach acid and we make sure that it's at the proper level. If it's too low, we really need to get your stomach acid up there so you can start killing bacteria as it's coming into your body. Pamela Walker, awesome. I think you should get one on Amazon. How is high stomach acid determined? I have constant heartburn. That is a great question. So most people with heartburn actually have low stomach acid. It's crazy, right? You would think high stomach acid, heartburn. But for most of us, it's actually low stomach acid. And what's happening, if you picture your little stomach here, let's say it should be full of acid, you know, up to there. And when it's full of acid, we're going to put it back near its esophagus right there. When it's full of acid, it communicates properly with this little sphincter right here. And it tells this little sphincter to close. When there's no acid in there, that sphincter can actually stay open. And the tiny little bit of acid that's in there will start sloshing up and causing heartburn. So I'd say about 5% of people I meet actually have high acid. It's very unusual, and most people have low stomach acid. So the next thing that we look at is the gallbladder and the liver over here. And that is the second stop where Bob should get killed. All of our body should be producing enzymes, and those enzymes help break down our food, but we also need our gallbladder to secrete bile, which acts like an acid to basically kill Bob. And I'm pretty sure I have a poll here for this too, so let me take a look and see. Okay. Do you know if you make enough pancreatic enzymes to digest your food? So definitely no, I need to take enzymes, or I'm not sure. Okay, so wow, I'm gonna just end it because you guys voted super fast on that one. Well done. Share results, there you go. So 93% of you guys said you're not sure. And that's really what I run into a lot in practice. I find most people haven't really either thought too much about it or are not sure. And it's a super important part of your digestion. And so we work through that together to make sure that you understand if you need to take digestive enzymes or if you need to support your bile. All right, let's find out what else Bob is doing next. So after Bob makes his way through the stomach, gets dropped into the opening to the small intestine. So I'm gonna put my stomach back here, and you can see the stomach connects with the small intestine right here. This is actually 22 feet long. It's obviously not actually 22 feet long on this one, but in real life, 22 feet long, which is crazy. And so Bob does its journey through the 22 feet of the small intestine with the final stop going all the way through there, with the final stop being the large intestine, which is the orange thing over here. And once in the large intestine, Bob should be super happy hanging out with trillions of friends and neighbors. This is exactly where we want our bacteria to be. However, in the case of Sibo, Bob gets a little adventurous and decides to actually move backwards into the small intestine. It looks nice and quiet in there. The small intestine is almost sterile. It is super, super empty of bacteria, unlike the large intestine. So Bob makes the big move, ignores all the warning signs, and bravely sets up a new home in the small intestine. And soon after, all of Bob's friends do the same. And suddenly you have a great migration of bacteria from the large intestine up into the small intestine. And that is basically what causes Sibo, is when you have that overgrowth in the small intestine. So because Bob is an organism, they are alive, they need to eat just like you and I, right? And the foods that they need to eat are typically foods that are very high in fiber. They love to eat apples and pears and chickpeas. I'm just gonna put my camera up a bit so you guys can see me better. Garlic and onions, basically anything healthy with loads of fiber is their favorite food. So I'm curious to ask you guys, which foods seem to bother you the most? I'll give you a moment to vote on that. So is it sugar? Is it apples? Is it chickpeas and other legumes? Carbs? Meat? Lettuce? I think it only lets you choose one, your worst food. Okay, a couple more people voting. Awesome. Okay, so 40% of you said carbs, pasta and breads, and then the other 33% was chickpeas and other legumes. So that does not surprise me at all. That is typically what ends up showing up as being the most problematic foods for people. And we're going to chat a little bit more about why that happens. So if you look at this picture here, these are Fodmaps. So Fodmaps is an acronym for fermentable oligo-di-monosaccharides and polyols, Fodmaps. And basically what it means is those are the foods that contain a lot of fiber and a lot of undigestible food, which is wonderful for the bacteria because they basically have a buffet to feast on all the time. And so if you look down here where it says fructose, lactose, sorbitol, mannitol, fructans, and GOS, those are often the ones that people really react to. So you can see there's beans and legumes, there's cauliflower or broccoli, sweet potatoes, chewing gum often has sorbitol, lactose, and fructose. And then you can see all the carbs and stuff here. So it's not a mystery as to why those foods cause the most problems for people. They also feed the bacteria the best. And when the bacteria are happy, guess what? They produce a ton of gas and ferment like crazy. I will send you guys, or you can go to my Instagram page. I do have a nice handout that talks about the top 5 foods that really bother people with Sibo and IBS. And you can use that as a little bit of a start guide to cleaning up your diet. All right, so here's the Bobs. They love eating all these foods. And guess what? When they eat it, it produces a ton of gas and damage. So the small intestine actually starts to fill with gas and it stinks in there. Those gases are pretty nasty. The walls of the intestine become inflamed and damaged. And it creates a tremendous amount of pain. When you have a small intestine that's like a little tube that's normally supposed to be really flat, it suddenly gets filled up with gas. That stretch is what causes so much pain for you. And these are the 3 gases that we know of. So hydrogen is the most common gas that we measure. and methane. And then we have a new friend on campus, hydrogen sulfide, that we've just discovered and are starting to measure as well. Each gas on its own is very powerful and toxic, and the gases make you feel pretty terrible. As the gas grows inside of you, your belly will stretch. I get a lot of women telling me I look like I'm 3 months pregnant. I look like I'm 6 months pregnant, but I'm not. And that's because of the stretch of the gas inside. And I'm just gonna quickly, okay, I'm just all cut up. Awesome. So each gas is pretty unique in terms of what it causes inside of you or the symptoms that it produces. If you have a lot of methane, you're going to tend to be more constipated, those little round, hard rabbit poops. If you produce a lot of hydrogen, it's actually going to cause more diarrhea symptoms for you. And if you have hydrogen sulfide, you actually end up with both constipation and diarrhea. So good news is you can actually take a test for this. This is me doing my breath test for Sibo. It's pretty simple. It's just a kit that you take home. You blow into the test tubes over the course of a few hours, and it tracks your gases, and it shows you whether or not you're producing an excess of hydrogen or methane. And the good news is once you find out you have it, there are tools and ways to treat it and to get rid of it. That's one of the things I do in practice, and it's one of the things that I do in my groups with my patients. And she lives happily ever after, but Bob, bye-bye, Bob. Bye-bye, Bob. So these are the 3 Sibo types. And this is a quick little breakdown sheet. So you can see very quickly, if you have something like methane, you're gonna have the bloating and cramping. You get that with all of them, whether you have methane, hydrogen, or both. Diarrhea is more for hydrogen sufferers, and constipation is more for methane. Weight gain tends to happen more with methane, as it actually slows down your metabolism, but everything else is the same after that. You'll get leaky gut with both of them, food sensitivities, and then you may even actually have deficiencies of nutrients like B12 and iron. So I don't want you guys to use this to diagnose yourselves, but I just want you to see, if you take a quick glance at it, okay, yeah, I definitely can tell there's some of my symptoms on this chart. The top 10 signs of Sibo are exactly the same as irritable bowel syndrome. There's really nothing new on here, but this page I find is actually very surprising to a lot of people because Sibo can cause way more than just your classic IBS symptoms. Some people will get joint pain. Some people will get brain fog, anxiety, rashes, asthma. Essentially, any inflammatory symptom can be attributed to Sibo because it's creating a ton of inflammation inside of your body. This is, maybe I don't know if I can drop this link. No, I can't highlight it. This link here, I'll put it in my email out to you guys with the replay, but it's a link to a symptom severity score that I use with my patients and in my groups. And what it does is it gives you a chance to just fill out this little questionnaire, and it gives you a score as to how severe your symptoms are. It's really nice to have that baseline at the beginning of treatment. So then as you go through, you can start to measure and see how things are changing. And it breaks down your symptoms by body group. So it'll be just digestive symptoms, just immune symptoms. I find it super helpful. And so you're welcome to use that and fill it out for yourself to just have as a gauge of where you're at with things. All right, so people always ask, what causes Sibo? The #1 cause of Sibo is actually getting the stomach flu. Just good old stomach flu. I know, right? It's so unfair. It's kind of not surprising then why a lot of us actually have IBS and Sibo, because most of us end up getting the stomach flu at some point in our lives. There are lots of other causes of Sibo as well, not just gastroenteritis, and we're not going to get into each one, but in general, if there's a change in your anatomy, so let's say that you have a stricture or a blockage happening, of course, that's going to push the bacteria back up to the small intestine if more easily than if you had a nice open intestinal tract. Other diseases can also trigger Sibo. So something like having Crohn's or colitis can do it as well. And then a lot of medications contribute to Sibo, especially antibiotics and proton pump inhibitors or something to suppress your acid. So if that's resonating for you, that could be one reason why you may have developed IBS. So the way I approach SIBO in my practice is I like to think of your gut like a garden. And when people come to see me, typically their garden looks a little sad. I'm not going to lie. It's a little bit dry, a little undernourished. There's not a lot of good things living in the garden. But what I want you to aim for is to have this kind of a garden growing in your gut. Tons of healthy bacteria, lots of life, feeling good, lots of nourishment and nutrients. And that's really our goal. So when I approach SIBO, I always start my patients on this 6-week prep program or preparation program. And the point of those 6 weeks is to really get all of those basics in place. So I want to make sure that your stomach acid is where it needs to be. I want to make sure that if you need enzymes, you're taking them. I teach you how to prepare your meals, what kind of foods to eat. We talk about your pH balance. We get into so much stuff in those 6 weeks. It's so much fun, but I get everybody to start with that. Because once you have that in place, then you're ready to move on and actually start eradicating the overgrowth of SIBO. So one of the things that I offer is this 6-week group gut reset. And the reason why I started offering it is because I don't have room anymore in my one-to-one practice. It got really full and I was super frustrated. I was like, how can we get this information out to more people and get more people knowledgeable about how to actually start fixing their digestive systems? And so I created these small groups and I'm running them for 6 weeks and they're 90 minutes. So we get to spend a ton of time together, which is super fun. And I deliver all the supplements you need for those 6 weeks straight to your door. So you don't have to think about it. You're not running to health food stores trying to figure out what you should be taking. I literally just bring everything to you and we go through it all together as a group week by week. I think the feedback I get from people that they love the most, Ginger wants to say hi to you guys. Hang on. She's just not going to give up. There's Ginger. So the feedback I've gotten, the best feedback I've gotten is that people love having that opportunity to ask questions in those 90 minutes, right? What a troublemaker this dog is. So a lot of patients also ask, why group medicine? Why can't I do this one-on-one? One of the huge benefits is that it's less costly. We can charge less per visit when I have more patients working all together at the same time. I get to spend way more time with you each week. 90 minutes is a really beautiful amount of time. But really the best thing is that healing happens when we're in community, and there's a ton of studies to show that. And that has been my experience running these groups, is that people really enjoy the experience of having other women who share similar experiences. We talk about the farts and the burps and the diarrhea, and we talk about a lot of other stuff too. But it just is a really nice way to hear what's working well for other people. So over the 6 weeks in the program, what we cover is pretty huge and extensive, but you're going to figure out what's been causing your diarrhea and your constipation. For some people, it's not SIBO. For other people, it could be related to stomach acid or how they're balancing their meals or which probiotics they have not been taking. So the first 6 weeks is really for anybody to reset their gut. I run a second group when that's done to get into the eradication part of it. But definitely during those 6 weeks, you're going to figure out what has been causing your diarrhea or your constipation. We talk about food sensitivities. We talk about why you're so bloated after you eat. We talk about if you might be actually sabotaging your digestion. We get into a lot of tests that should be done, whether that's the SIBO test or blood testing or stool testing. We talk about enzymes that you might need for digestion, if you're missing any nutrients from your diet. And we talk a lot about health habits. There's a big mindfulness component to this group, which I love. We do meditation at the beginning of each session together. Don't worry, it's just for 3 or 5 minutes. And we always do some sort of mindfulness exercise. And that is because there's a huge connection between your mindset and your gut. And you cannot fix one without fixing the other. It has to go hand in hand. We talk about if your diet should change with the seasons, how to balance your macronutrients. We talk about your liver and your gallbladder. Of course, the transit time, which you guys will all be doing tomorrow morning to check it out. How much raw food versus cooked food you should be eating. And if you need to take probiotics. So one of the things that we'll do together in the group is that I lead you through a probiotic challenge, where every week we actually try a different probiotic. a sample size to see actually which one appeals to you and how your body responds to it. So these are the things you get over the 6 weeks with me. We get 6 sessions together for 90 minutes. Sometimes Ginger makes a last minute appearance, which is super fun when you're trying to lead a meditation. Every week I will answer your questions. I'll talk about which tests to do. I give you your treatment plan, and I give you an app to track your symptoms as well. I give you a 28-day meal plan, which my nutritionist Sierra has helped me put together. She's an amazing chef, and these are beautiful recipes to keep you inspired for that time that we're working together. And of course, I send you the 6 weeks of supplements, and with a couple little gifts from me too, because I love gifts personally. This is a sneak peek at the software that I use with you guys during the group. So I use something called Practice Better, which is really nice because it gives you a chance to actually put in your food that you're eating. You can track your stress levels. You can use this to whatever extent you want. This is not mandatory. You know, we have fun in the group. You use this if it's helpful to you. And of course, it's helpful for me to see how you're doing with everything. This is their poop entry, which I just love. You can choose the consistency of it and everything. It's so helpful because then we look back over time and we see, oh my gosh, look how things have changed over the last 6 weeks. It's pretty incredible. So the class schedule for the group that I have coming up next, we're going to run an evening group that's on Tuesday evenings starting at 5 to 6:30. We're starting on May 11th, so it's going to run through May and June. And pretty much each class is similar to this style. It's 90 minutes long. We always start with a little meditation. We check in with each other and see how the week has been. We go over last week's treatment, and then there's lots of time for Q&A. I always teach you guys something about your gut, a little nugget that you may not have known about before. And then we cover the treatment plan, set our goals for the week, and we check out. It flies by. It is so much fun. It has been such a blast running these groups with women. So I would say think about joining this group if you are one of those people that worries about what you are going to eat all the time. If food is on your mind and you're frustrated and you don't know what is a safe food for you and what is not a safe food, I would say this group would be ideal for you. If you have a mind map of every toilet in the city, definitely want you in this group. There's no reason why you should be worrying about where you're going to have a bowel movement. And of course, if you're one of those women that looks or feels like they're 6 months pregnant, but you're not, this is definitely a good group for you. So this is not for you if you have a flat belly, if you have normal log-shaped poops, and if you never think about what you're eating. You don't have to join the gut reset. You're good. Some of the questions people ask me is, if I have Sibo, can I join the program? Yes, I created this first 6-week program for people to be prepared to enter my second group, which is the Sibo Sisterhood. And actually, it's a requirement. I insist that you do this one first so that you have all of that sorted out before you go on to eradicate any of the bacteria. Are the sessions covered by insurance? Yes, they are, because they are treatment sessions. It's fantastic. We can give you an insurance receipt, and then you can submit that for your insurance, which is awesome. Do you have to be a patient of mine? Yes, you do. So if you're not a patient of mine already, then I will do a little half an hour intake with you before the group starts, just to make sure that it's safe for you to complete the program. If you're coming from another practitioner, I often don't need to do that 30-minute. I might be able to just get some notes from them and a letter of referral, and then we're good to go. And then once you're done seeing me with the group, I will refer you back to your other practitioner. And people often ask after seeing this lecture, if I think I have Sibo, can I get tested? Yes, you can. Just contact my office and we will get you all sorted out. I see something in the Q&A. Can Oreos cause black stool? That is a great question, Kelly. I don't really know. I would think it's possible. You'd have to eat a pretty good amount of them, for sure in children, because kids, you know, don't tend to eat that much in a day. So if they eat a whole row of Oreos, it could be black. That is a great question. Yeah. And I'm just going to check this here. I see one more little chat question. Yes, Stephanie, you can share the video. No problem. Absolutely. And 2 sleeves, Kelly says, yeah, I think 2 sleeves of Oreos could do it. I think so. Oh my gosh. Tests can be remotely done also. Yes, we can do the test remotely. Depending on where you live, we can arrange for pretty much anywhere in Canada. And if you're in the States, I have some colleagues there that you could connect with to do the test. Mm-hmm. And then Alex asked, does this course cover other digestive issues like Candida overgrowth? Such a great question. We do touch a bit on Candida. Oftentimes fungal overgrowth and Sibo go hand in hand. And so we actually do talk a little bit about it. To be honest, we get into it more in the second group when we're doing the Sibo sisterhood and getting into eradication. But the nice thing about the group, the one I just ran, I always ask questions each week before we start. I want feedback and I want to be able to answer your questions. And so a lot of them were talking about cravings. And so we just did a segment on cravings and how to manage cravings. So that's the beauty of having a group and being interactive week to week. We can really just decide what topics we want to cover. And actually that group has decided to carry on with just more education pieces. And then what is the role of parasites? So parasites are typically an issue in the large intestine. And so I will do a stool test for parasites with some of my patients if I feel that that's an issue for them as well. And sometimes it's hard to tell, and sometimes it's both. And so if your naturopath suspects it's both, often we'll recommend doing a stool test and the Sibo test as well to figure that out. Yeah, Stephanie, did we talk about the gut biome? That is all we talk, no, just kidding. We talk about a lot of different things, but we talk a lot about the microbiome in your gut. It's one of the reasons why I do the probiotic challenge, because there's different strains and types of probiotics. And oftentimes I'll hear patients say, oh, I tried probiotics, they didn't work for me. They made me bloated. And I'll ask, well, what kind of probiotic? I don't know, a probiotic. There's a huge range of probiotics, and there's actually 4 main categories. So we go through those categories together and talk about how important they are to you. Those are great questions. All right. So the pricing for the group, the 6-week supplement package is $149. I give a discount because it's nice that we're sort of sending it out to you all at once. It's shipped to you free of charge. You don't have to worry about it. We send that off to you. And then you get the 6 visits with me at $99 a visit instead of $299 per visit. So you end up saving a ton of money, and you still get to submit it for insurance purposes, which is pretty boss. There are actually, the group is already half full. I try and keep the groups fairly small. And so I would suggest, if you are interested, that you register today and don't wait until the video goes out to everybody. And it will be just first come, first serve. Is there a better fit program if I already know my issue is Candida? That's a great question. So a lot of my patients know that they have Candida, and I will still tell them start with the gut reset. And the reason why is that we all want to jump straight into eradication. We just want to like kill it, go straight to the killing. When in fact, we need to first create balance and health in the digestive system. So if you have not yet addressed those things that we talked about tonight, like your level of stomach acid, like your level of enzymes, if your meals are not properly balanced, any of that stuff that we talked about, if there's still some areas there that you're not sure about, I would do that first before you go in and actually start killing the Candida. You're going to be way more successful at it. And Candida can take a while to get rid of. So I think it's better to prepare your body properly and have better results when you actually go in to start eradicating it. All right, fantastic. So let me just pop in the chat here. So here's the link for you guys to register for the group. And it's, if you scroll up, it's a little bit higher up after all of these questions. And so I actually have a special offer for the first person who registers for my group. Before I end the webinar, I'm going to give you a free consult with me. So typically the 30-minute gut consult is $149, but the first person to register gets it for free, which is my pleasure. Kata was it me? Was it me? I don't know. I don't have my software open in front of me. I will definitely let you know when I get off of the webinar. I will take a look, and it just comes in order in which people sign up, and I will email you and say, you got it, you're the first one. Amazing. I'm looking forward to meeting you, Kata. That's awesome. So I'm happy to hang around and answer any other questions that any of you guys have about digestive health. And otherwise, I'm going to see there's something. We have like the Q&A and we got the regular one. Okay. I answered that one. Okay, Nicole, that's a great question. What happens if there's a course that we cannot attend? So the 6 weeks are mandatory in the sense that when you sign up for them, it's as if you signed up for a one-to-one session with me. So I do want people to commit to the 6 weeks. That being said, life happens, emergencies happen. I totally understand that. And so in that case, what I do is I actually connect you either with me or one of my other practitioners, and you do a one-on-one, a 45-minute one-on-one with them. You pay a $25 admin charge for that class that you missed because we had to hold your spot anyway, and then you do your one-on-one with the other practitioner. So we always figure out a way to get you the information. The reason why it has to be that way is because I cannot give treatment to a patient over email or phone or video or anything else. I really need you to be live so that my board is happy with me. So I hope that answers your question. If you just miss like a few minutes at the beginning or the end, we just fill you in. It's just if you had to miss a whole class. Alex asks, are the supplements the same for everyone, or can they be more specific if a person is doing other treatments for other illnesses? Yeah, that's a great question. I actually have a couple of patients registered right now, and I did tweak their supplements, which my receptionist is probably going to lose her mind when I tell her that I offered to do this for people. But if I know your case, or if you've been working with one of our NDs and let's say we already know you need to take this or you can't take that, we're just going to customize it for you. And to be honest, the big value that a lot of people love with this group is the education and having that access to me every week. So I'm more than happy to tweak the supplements. I even have one patient who's deciding to do it without any supplements. She just wants the education piece. So once we chat one-on-one, we'll just discuss that. You let me know what your preference is, and we'll give you your supplement package based on that. Mm-hmm. Great questions. Francine says, I only have one symptom, sudden diarrhea and constant UTI. Should I join? Absolutely. That is exactly the kind of symptoms that we deal with. UTIs are very common along with diarrhea. And I think that would be actually a perfect reason to join. We'll figure it out in the 30-minute consult together. If I really don't think the group is right for you, I'm going to tell you. I only want patients joining it that are a great fit and that I know you're going to get good results from it. Mm-hmm. And Alex, no, the Sibo test is not covered under the course. So the Sibo test is $220. It's just a separate test that it's just an expensive test. And so if you do want to do the Sibo test, you can do it. You don't need to do it obviously before the gut reset. A lot of my patients, when I meet them, they sign up for the gut reset and they do their Sibo test at the same time, so that by the time the gut reset is done, they're ready to decide if they want to move on to getting rid of Sibo if it was positive. Amazing. In the Q&A, check the chat here. If I can't join this session, will the $99 be available for a future session? No. So each session you kind of pay for the 6 weeks. They're all starting like May 11th. Each one would be $99. And if you miss that session, I just charge you the $25 admin fee. I don't charge you the $99, but you would have to make up that session with a practitioner before the next week so that you get all of the treatments that you need in that time period. Yeah. Thank you, Tammy. I'm glad you enjoyed it. Francine, did you see my question? Let me see. I think it was the one I just answered over here, right? Only one symptom. Yeah. Oh, if you can't join, will you be able for future for another time? Oh, like, could you do another session 4 months from now? I would say no, because I actually never know when I'm going to offer these. Bye, Pamela. Thanks for joining. Yeah, I don't actually know when I'm going to be running them. And so I would say no. That's once you miss that session, because think of that session like an appointment where you get tons of treatment information. You need that treatment information to do actually the next class. Mm-hmm. Does that answer your question, Stephanie? I wish I could talk to you. Find out what you're thinking. Anyways, if you guys do have any more questions about the group or how it works, feel free to send me an email. I'll show you my email here. I'm happy to chat about it, or come in for a 30-minute gut consult. If the group is not right for you, I'm going to find something else. I see, Stephanie. Yeah, I'm hoping to run it again. I do plan on it. I may take some time off after this group just to have some summer relaxation, but definitely I think in September I will be running it again. Mm-hmm. Yeah. Perhaps the fall, winter. Yeah, exactly. Just, you know, stay on my newsletter list, and I will definitely be sending out information as new groups get released. Definitely. Awesome. Thank you, Nicole. Thank you guys, everybody, for joining. I really appreciate it. And I wish you guys a wonderful evening. Okay, bye.